welcome to our COVID-19 update, where we'll be speaking to the Minister of Health, the Honorable Dr. Frank Anthony. Hello, Minister. Thank you for joining us again today.
Well, thank you very much for having me on the program.
Okay, Minister, let's start with the latest COVID-19 vaccination numbers. Can we have an update on that?
Well, I think we've been working very hard over the last couple of days to make sure that more people come out for their vaccination. And as you know, we have been appealing to persons who've already received their first dose to come and get their second dose. So as of yesterday, we have across the country 214,251 persons who would have received their first dose vaccines. That would be approximately 44% of our adult population. We've also seen 79,802 persons who have received their second dose vaccines. That is approximately 16.4% of our population, which means that they are now fully immunized. So we want to continue to appeal to persons who have received their first dose and they are now eligible for their second dose because the time interval would have lapsed or would have been there almost. So for the Sinopharm vaccine, the time period between first dose and second dose is 4 weeks. And we still see that there are people who would have received their first dose Sinopharm vaccines. 4 weeks would have elapsed, but we haven't seen them coming back to the facility for their second dose. If they're not fully immunized, they're putting themselves, in a sense, they're not going to have the full benefit of the vaccine. It's only when you're fully immunized, meaning that you have had both doses of the vaccines, that you will be able to get the benefits of the vaccine. So we want to appeal to those persons to please come and to get their second shot. Similarly, we know that a lot of persons who took the AstraZeneca vaccine, they are now eligible for their second dose. And while initially we had a time interval of 12 weeks, anyone now who would have been able to spend at least 4 to 12 weeks can come and get their second dose. So again, there are lots of folks out there who would have gotten their first dose. As the numbers have shown, 214,251 persons, and quite a number of those are now eligible for their second dose AstraZeneca vaccine. So please come to the health facilities where we're vaccinating so that you can get your second shot.
Okay, Minister, we know that Region 10 is still lagging behind, but how are the other regions performing?
In terms of first dose, as you rightly said, 10 is still underperforming. But maybe I can quickly give you a picture of all the regions. So Region 1, they are now at 51% of their adult population. Region 2 at 41.4%. Region 3 at 43.8%. Region 4 at 45.2% of their adult population. Region 5, 47.8%. Region 6, 51.9%. This is the region with the highest vaccination first dose so far. Region 7, 43.6%. Region 8, 28.3%. And Region 9 at 41.9%. And Region 10 has been lagging. They're at 13%. Slow progress, but still lagging behind all the rest because most of the other regions are either in the 50s or in the 40s. So we would like to see improvement in 10, and hopefully we can urge more people to come out and get vaccinated.
Hey, Minister, in terms of specific areas, do we know of any community or sub-district, so to speak, that has had a greater percentage, if not all, of the adult population being vaccinated?
That would be difficult to get because we haven't really done it, measure it specifically by each village. Mm-hmm. But we are working, we normally track it I guess we can get some of those statistics, but that would really get to the grain of it, because what we do, we aggregate from the villages upwards, and so we have those aggregated numbers. But if you want to have the disaggregated numbers, it's there as well. But I don't think any area would have achieved 100% as yet.
Okay, Minister. Now, switching a little bit off of COVID-19, I know you'll be chairing a panel discussion at the UN high-level meeting on HIV this morning. Could you tell us a little bit about what the panel will be discussing, and what are some of the advancements Ghana has made in terms of HIV treatment of persons with HIV?
So, as you know, the UN high-level meeting, these are meetings that were started about 25 years ago, and they have become the focal point of where persons, both the political and academic persons, are able to meet and to review the progress that would have been made over the years and to chart a course for the next 10 years or so. In 2016, the leaders have met at the UN, and one of the declarations that they made then was for us to work towards the public health, to end AIDS as a public health threat by 2030. And to get there, they have set several milestones. So there was a milestone that was set for 2020, and that is they identified 3 key areas that we should look at. And then they said countries should aspire to at least get 90% of in each of these 3 areas. So the first 90 is people knowing their status. The second 90 has to do with people being on treatment. And then for those persons who are on treatment, they must be virally suppressed. That's the third 90. And they hope that countries across the globe would have been able to achieve this by 2020. So basically you had a target that was set for 90 and 90 and 90 by 2020. Unfortunately, while a lot of countries have worked towards getting to the target, most countries were not able to meet it. And in the Caribbean as a whole, for the first 90, we were at 82%, for the second 90, 67%, and for the third 90, at 59%. In Guyana, for 2020, we were able to achieve for the first 90, 95%, which meant that we exceeded the target that was set by UNAIDS. The second 90, however, having people on treatment, we're still at 71%. So there's still a lot more work to be done there to get more people on treatment. And for those who are on treatment, who are now virally suppressed. And when you're virally suppressed, it means you can't transmit the virus to anyone else. For that third 90, we in Guyana, we are at 69%. So again, we have some more work to do, but and we are going to work to make sure that we meet this target. Now, this particular meeting, one of the things that was set was for us to now move from 90, 90, 90 and to talk about 95, 95, 95. And so we are hoping that countries now can fill the gap in terms of the 90s and then move forward to be able by 2026 to achieve 95, 95, 95. If countries do that, then we will be on track to end the AIDS by 2030. So there's a lot of work between now and 2030 to be done, and we are committed to doing that type of work. This particular UN meeting, yesterday the President spoke at the General Assembly and outlined a number of important areas, including looking at the actions or the things that are structurally undermining the response and how to get more financing so that we can move this response and achieve the ending of AIDS by 2030. So President spoke yesterday, and today we have the honor of chairing one of the panels. And so the panel that I would be chairing is a panel that talks about how do we put people at the center of the response. And we're looking at getting persons who are HIV positive to be more involved in decision making. We're looking at the key populations to not only be part of decision making, but to be able to offer things like testing as a service, to be able to provide services such as treatment and care, and to reach out to other vulnerable people. So how do we involve them in this response, not just as persons who are receiving treatment, but persons and organizations who can work in communities that are hard to reach and be able to identify the people who are vulnerable, who need service, and be able to offer that service, and what mechanisms can be put in place. And of course, there's always the advocacy to make sure that laws that inhibit the response or restrict the response, that we work to make sure that we can dispel with those laws. So there's a lot of work to be done, and this panel is going to look at a range of things. But the main thrust here is how do we put people at the center of the response and to mobilize enough resources so that community organizations can really offer the kinds of services that is currently offered in most countries nationally. We want community groups to be involved in offering these services. We have good examples here in Guyana because we were one of the countries who have embraced social contracting, meaning that the government will give to NGOs within the country subventions so that they can then work with persons who are affected by HIV. So we have been piloting that and working on that, and hopefully this type of model, we'll see more countries adopting it.
Okay, thank you for that, Minister. Now, before we go, I have a question from a media house. This one is from Loop Caribbean in Trinidad and Tobago. They're asking if Guyana has seen any trends of persons leaving to go to the U.S. To get vaccinated.
It's going to be very difficult to monitor that, because if people are leaving here and going to the U.S. for vaccines, they're not going to be registering anywhere or telling anybody they're going. So we don't have any information on that. But I would say that our program here is quite robust, and anyone who would like to get a vaccine, at least the ones that we are offering, which is Sinopharm, Sputnik V, and the AstraZeneca vaccine, and soon we'll add the Johnson & Johnson vaccine. So any one of those vaccines, persons who want them, and they're 18 years and over, they can get a vaccine. So we don't have barriers to people accessing vaccines here in Guyana, and so I would imagine that very few people would have the need to fly to any other country to get their vaccines.
Okay, thank you for that, Minister, and thank you for your time today. This has been DPI's COVID-19 update. For more information, visit our website dpi.gov.gy and our social media platforms.